everyone. This is Dr. Katie Gross from Performance Chiropractic, and this is my assistant Debbie today. We are going to be going over some of our trigger point therapy class work. We're unable to do these classes in the office at this time, and with people being home and not able to get in for care, we thought it would be a nice way to be able to work on yourself or your partner. So follow along, and if you have any questions, just email us and we'll get back to you. So we're going to start with the shoulders today. We're going to work on the traps here. This is something you can do on yourself or on a partner, or have your partner do to you. So first thing you want to do is feel for the top of the trapezius muscle. It's that really thick muscle right here. You're going to feel along the top of it for any tight areas or points of tension. When you find one, like here, we're going to have your partner or yourself, you can hold like this, bring their arm up, and you're going to bring the arm down across the body towards the pocket. We're going to do that 5 times, so go ahead and bring that down while you're holding steady pressure here. Good job. Last one. Okay, bring the arm down. And we always want to do both sides. It's very important that you have both sides stretched out evenly. 2 more. If you're doing this on yourself, go ahead and relax. Or a partner, you want to move along the muscle. Don't stay in one spot the whole time, because that can get uncomfortable, and we want to work the whole upper trap here. Another thing you could do, let's say you find an area that you push down on and you feel a zinger or a pain coming up into the head or down into the arm. If you're feeling some kind of nerve pain, numbness, tingling, burning, I would say back off of that. But if it's just a pain that's radiating, what you can do is press and hold the area for 5, 4, 3, 2, 1. Back off. And then you can continue that until that pain starts to subside. Good job. So next we're going to work into the pectoral muscles here. These are really tender. This is a very tender area, especially for people who work on computers a lot, because we're in this position a lot. So what we're going to do is you find the shoulder here, find the clavicle or collarbone here, and come right below it. There's a little kind of triangle here where they come together, and you're going to find the thick part of that muscle. So now, instead of having the arm up here, we're going to do the opposite movement. You're going to come down here and come up. Don't push too hard, because this is a very sensitive area. And again, we're going to do 5 movements. And move that hand around a little bit so you're not on the same spot the whole time. Good. Here we go. Always do both sides. Good. And 5. Perfect. Yeah. Now, if you're doing this one on yourself, you can find that area, bring the arm down, and just bring it back. It's very simple to do on yourself. Of course, we're not going to be able to push as hard on ourselves because we don't like to inflict pain on our body. Okay, so another one for the trap area or shoulder blade area. Actually, let me have you turn this way real quick. If you find a shoulder blade here, if you come along the bone as it comes towards your spine, if you find that area between the spine and the bone, which is a small area, you're going to want to push here. And you can do the same movement that we did with that trapezius, where you go down and over. There's multiple ways to work on this area. This again is for people who have a lot of computer desk work. Good, and just bring that up and over. The other way to work on this area is to press and hold and have yourself or your partner bring their chin down to their chest and then turn to the opposite side. Good. And we'll do 3 of those. 1, 2, and 3. You can move along those paraspinal muscles or rhomboid muscles through here. Let's do this side. Just go down and over. Good. Now if you're doing this one by yourself, that's pretty tricky, but what you can do is take a ball, any kind, like a tennis ball, lacrosse ball. If you can lean up against a wall and hold pressure, then you can do these movements yourself. Okay, so next we're going to do a little bit of the neck. We have to be very careful because this is a sensitive area and we do not want to injure anything. So if you go to the back of the neck, right here, that's where your spine is. We don't want to be on there. You want to come over about an inch to the thick part of the muscle, very gentle pressure, and just slowly turn the head. That's all we're going to do. Very, very gentle pressure, a very small turn of the head. You're not turning all the way, it's just to get a little bit of a stretch in there. We're keeping it very simple with the neck. If you're doing this to yourself, you can just simply hold that area, either hand, and turn away. Very simple and gentle stretch. Okay, and the last one we're going to do is working on the forearms. This is, again, if you're on computers a lot, tablets, phones, we can have a lot of carpal tunnel-like symptoms. We can have pain, difficulty moving our hands and fingers. So when you look at the forearm, you have 4 muscles that sit here and 4 muscles that sit here. Where the arm thins, it becomes tendon. We do not want to work in this area. So what you want to do on the top is find a tight area in one of the muscles. You don't have to be very specific. Bring the hand up, bring the hand down while applying pressure. Good. And just follow along those muscles. Good. Now turn the hand over. You're going to bring the hand in and bring it out. In, out, in, out. Good. Let's do the other side. Hand up, down, up, down. Good. One more. And that's a good one. The right side is usually the worst side because that's our mouse hand. Good. 3, and we'll just do 4 here. Perfect. Shake it out. All right. So that is all we're doing today, just keeping it very simple for working at our desk. If you want to do those forearm stretches yourself, again, you just press and hold here and here. Very, very easy, very effective. Only do these about 5 times per side. We don't need to be aggressive. We don't want to injure ourselves. Listen to your body. If something hurts, then you need to back off. We hope this helps, and if you have any questions, again, you can email or call us. Thank you. We hope you have a great day.